Hi, BISC students. Today we're going to be going over Chapter 19, the digestive system infections. This is the last chapter that will be covered on exam number 3, which is this upcoming Wednesday. So make sure you are going through all the chapters, watching the videos. The chapters are 16, 15, 16, 18, 19. So make sure you're going through all that. I posted a couple other PowerPoints that have 1 or 2 slides in them that have extra information, like ELISA and agglutination tests, for instance, how those function. All right, so let's start off with the GI tract in general. The GI tract consists of a lot of organs, from your mouth to your stomach and the small intestine, large intestine, and everything in between. And there's a lot of ways that our GI tract limits digestive system infections. For instance, in our mouth, our saliva has lysozymes in it. It has salts. The acidity of the gastric juices in our stomach. Most bacteria can't survive those acids. There is one that we'll talk about that can. Bile salts. And then even the stomach and the small intestine have physical barriers of a mucus lining to it. And that mucus lining is actually a physical barrier as well. Also, you could add to this list the normal microbiota, because the bacteria in your GI system, the good bacteria, we want them to remain there, and we also want the fact that they're going to help protect against pathogens that are trying to colonize. Now, they don't do it out of the fact that they have love for us. They do it because we give them food, we give them a space to live, right? And in return, we ask for a little bit in return. We ask for protection and some synthesis of vitamins. All right. And here you can see that anywhere you can think of in the GI system, you can see that there are bacteria that live there. Or can colonize there. Gums, teeth, mouth, small and large intestines, the stomach, anything associated with the small and large intestines like lactobacilli, streptococci, bacteroides. We refer to those as enteric bacteria because they live in the GI system. So there are thousands of different species that are found in our GI tract. Most common in the mouth is Streptococcus. Most common in our feces is Bacteroides. We also can find some fungi and some protozoa that live in the GI tract, although it's mostly going to be bacterial populations. Very few fungi and protozoa live in the GI tract. One of the only protozoa that I can think of that can live in the GI tract and will cause disease is Giardia, which we will talk about in this chapter, and it causes gastritis or gastroenteritis. All right. Here again, I've already mentioned the normal microbiota and how it helps us, but these are some more examples of how it helps prevent GI infections, right? Let's say you eat something like a piece of pork that's been sitting out for a while, right? You make yourself some pork and it's been sitting out for a while at room temperature. Chances are there's been bacteria that's growing on it, something that makes a toxin possibly. But let's say you consume it, the bacteria moves down into your small intestine. Now, all of a sudden, that bacteria that could cause illness has to outcompete your normal microbiota to cause illness. And they're not just going to give up space, and they're not going to just give up nutrients to these invaders. So they actually fight on our behalf. Now, granted, it's not altruistic because they don't work that way, but the enemy of my enemy is a friend, right? So these bacteria help quite a bit. And one of the other things that's really important is that the bacteria in our GI tract help with digestion. When it comes to consuming plant-based material, we're really, really bad at digesting it. Our body's pretty terrible at it. So we rely heavily on bacteria in our GI tract to actually help digest plant-based material as much as possible. Also, there are some nutrients that they can produce. Impacts metabolism, obesity, affects depression and diseases, trains and modulates the immune systems. Again, more roles that our normal microbiota have that are very important. There's a paper that I have, and I'm going to show you guys later in the semester, before the end of the semester. I'm just going to post it, that talks about how your gut microbiome can actually affect mental health and chemicals that reach your brain. It's very, very interesting, but you wouldn't expect that gastrointestinal bacteria would have a very big influence on chemicals that reach the brain, but they do. I'll show you that paper later on before the end of the semester. Excuse me. So some clinical vocab, diarrhea. You've all have heard this term before, I assume, and you probably have had diarrhea before. This is basically when you have passing of loose or watery stool. Usually, if it's not severe, if it's short-lived, it's called diarrhea. It's called something else if it's longer, if it lasts for a longer period of time, if there's a couple other things associated with it. Gastroenteritis is the inflammation of the stomach and the intestines. So if we were to break that term down, gastritis would be inflammation of the stomach, and enteritis would be inflammation of the intestines. So you can actually break that word down into its two components and say, okay, well, part of that is inflammation of the stomach, part of that is inflammation of the intestines. Now, when diarrhea becomes more severe in certain cases, where you have abdominal pain, lower back pain potentially, blood in your stool, mucus in your stool, that is referred to as dysentery, and it is much more severe than diarrhea. You're talking going to the bathroom quite a few times a day. There's no set number, but if somebody has diarrhea, they go to the bathroom a couple times, 2-3 times a day. With dysentery, you're talking about they're going to bathrooms significantly more than that. And one of the key factors of determining whether you have just diarrhea or dysentery is the fact that there could be blood and or mucus in your stool. Sometimes that's a little tricky because if you have diarrhea, what could happen is you could have a hemorrhoid rupture, and there would be blood in your stool. But that's not overly common unless you are going to the bathroom very, very often. Now, when it comes to GI infections, the transmission is the fecal-oral route. So from feces to the mouth, and we swallow it. This is due to mostly contaminated food or water. Right? Somebody goes to the bathroom, a cook doesn't wash their hands, touches your food, fecal oral transmission right there. Water, this is possible as well, but that's more developing countries. Our water treatment systems in the U.S. are not terrible. Depending upon where you live, there are certain places in the U.S. where water treatment is a problem. But in developing countries where water is a significant issue, contamination is a significant issue, water can be a big problem and a way to easily transmit these pathogens. And unfortunately, no matter how careful you are, we are always exposed to some degree of fecal contamination in our lives. It's just the way it is. Something that's really interesting, there was an experiment that was run, and I can't remember the scientist's name, but what he did was he went to the bathroom and he put shelves he put very small shelves up that would hold only a petri dish, and he put them at 3 feet, 5 feet, 7 feet, and 10 feet in the air. And then he went to the bathroom and had the lids off of all the petri dishes, flushed the toilet, and all of a sudden, anything that was in the toilet can create droplets or aerosolize something, and it goes up, and it would reach all the way up to the 10-foot little shelf, and every single plate was contaminated with an enteric bacteria, meaning a bacteria that's commonly found in your GI tract. So there was fecal contamination. Easiest way to prevent this, just wash your hands, right? I keep harping on this a lot. Just wash your dang hands and you should be all right. Now, you do have to be careful when you wash your hands. Washing them for 2 seconds, 3 seconds is not good enough. You need to make sure that your hands are clean, that you've gotten rid of as much bacteria on your hands as possible. Good 20 to 30 seconds. Water sanitation practices. So the U.S., we have water sanitation where they make sure the water is okay to drink. Food processing regulations. There are so many rules according to the FDA associated with food processing. That doesn't mean there aren't issues. For instance, there is a company called fast food company called Jack in the Box. I don't know if they're still around, but about 30 something years ago, what happened was they were processing cows at one of their facilities. They were disemboweling them, and when they were disemboweling them, you had to be very careful, because if you cut through the cow and you rupture the stomach or the small intestine, the meat is going to be contaminated with some level of fecal matter. Apparently there was that exact situation where a cow, the small intestine was punctured. There was fecal contamination. The cow, all that meat went into a large vat, and in these processing plants, these huge vats are just enormous. And what they do is they take all the meat and they mix it together with this giant mechanism that kind of aerates everything, and that's a perfect environment for bacteria to live and thrive. It has nutrients to consume, it has constant aeration, lots of space, right, and very little competition. So this was a perfect place to grow and incubate and create many new cells, contaminating the meat. What they did was they froze the meat and they sent them to their stores, to their restaurants, and the meat was used. And then all of a sudden we started to see, epidemiologists started to see numerous cases of gastroenteritis and food poisoning actually it was towards the Midwest in the U.S. because of the fact that this meat was contaminated. And what's interesting is you can actually backtrack these processes to figure out where the source is. And then even further from that, you can, because of all the regulations, you can look at the barcodes and some of the numbers associated with the barcodes, and that tells them what batch it was, what facility it came from, so they can even get that specific with where it comes from. It was very interesting, but almost all the Jack in the Box stores, restaurants had to shut down for an extended period of time because of all the contaminated meat that went out to all their fast food restaurants. This is not the only case. Peter Pan peanut butter had contamination. They had a recall on that. Now you have to be careful with recalls, because recalls are more of a safety measure, and they're not always, they're necessary to a point, but it doesn't mean because there's a recall that you are going to get some of the contaminated product. What they do is when they have a contaminated product, regardless of where it is, let's say it shipped from Mississippi to Texas, and that's where you see all the cases in Texas. But what they're going to do is they're going to put a recall on that product from that particular plant, regardless of any other circumstances. They're going to say any of this product that left the plant in Mississippi, we need to recall it all. So it's more of a be on the safe side to recall these things, as opposed to, oh yes, you're absolutely going to get sick. It's more of a safety in terms of making sure that there is no contamination. And if you recall these products, then you decrease the risk of more cases. I digress. How to diagnose GI infections? Well, first off is collecting a fecal sample. It's pretty easy. They provide a little basin. It sits in the toilet, and it kind of is this little basin-like plastic structure. And you go to the bathroom and you defecate into that plastic little container. And then what they do is from there they take it and they culture it, especially on MacConkey, because MacConkey is good with enteric bacteria. They could use molecular diagnostics. There's a lot of tests with that. I'm not going to really go into it. And then microscopic examination is also possible as well. You can identify parasites or parasitic eggs, the larval form, through microscopic examination. If I get the chance, I will try to take a photo of what we call pinworms. They are a microscopic worm that causes an infection in the GI tract of reptiles. And I will see if I can get a good image of that and show you what these parasitic worms look like. Other ways to look for issues in endoscopy, whether it's upper or lower. Upper endoscopy is where they shove a camera down your throat and then look at your stomach and your upper portion of your small intestine, and they just look for inflammation and damage. Lower endoscopy is a colonoscopy, where they go in through the rectum and they go in and look into the large intestine and that area. I've had a endoscopy done because I have celiac disease. They didn't know I had celiac, so what they did was they wanted to test, because my antibodies were very, very high for celiac disease, and they wanted to confirm. So they shoved a camera, doing an endoscopy, down my throat into my small intestine, looking for inflammation as well as damage, and they found it. So these are really useful tools, but you have to be careful what you're to know what you're looking for. If you're looking more for damage and signs of infection as opposed to IDing a specific pathogen. Okay, so let's start with the teeth and work our way down the digestive system. Plaque promotes tooth decay. Basically, plaque is these layers, these biofilms of bacteria that attach to the tooth, and it holds it really, really tight. The most common bacteria to start what we call dental caries or cavities is Streptococcus mutans. Strep mutans. It attaches to the teeth, and then it metabolizes whatever sugars that enter your mouth. They metabolize the sugars, and as a byproduct, it creates an acid. The acid then erodes away the enamel, the protective layer on your teeth, exposing the underlying portion of the tooth, what we call the dentin, and you start to have. That's when you start to have sensitivity. It starts to feel a little bit painful. If you let it keep going without having it addressed, you can get an infection, creating an abscess. And then obviously if it's too severe, the dentist may have to remove the tooth, or a root canal. Or if it's caught early enough, they can simply put filling in. Dental caries are cavities, whatever you want to call them. They start out being caused by strep mutans, but about halfway through the process, it switches to a different bacteria, a lactobacilli species, that takes over and starts to cause really deep cavities. So strep mutans starts it all and creates kind of superficial cavities that are just starting to create serious damage. And then all of a sudden, about almost halfway, a little bit less than halfway through, lactobacilli species take over as the main cavity-forming organisms. And lactobacilli produce lactic acid as a byproduct of metabolism, which can seriously damage teeth. So this is showing you here what a dental carie looks like. So here is your tooth, it's the crown, and then under here is the dentin, and then the pulp where you have all your blood vessels and nerves. The fermenting of the sugars, allowing acid byproducts, starts to erode away at this. The underlying enamel erodes. You have your dentin. When it gets down to this part, it becomes extremely painful in many cases. And if left untreated, it can go all the way down through the pulp and create an abscess at the base. So if it reaches this point, depending upon the severity, what the dentist may do is a kind of a drastic measure to save the tooth would be to open this all up, and then after first you would have to clear the abscess. So they would give you antibiotics to clear the abscess. Once that's clear, then in most cases they would do that. Then they would open this up, and then they would go in and they would do a root canal where they remove all the nerves in this pulp region, all the way down into here. And then they fill everything with a composite material. So it protects everything else that's in the underlying portion here. Notice the other thing about this is look at the gums. Okay, over here they're healthy. okay? But as you start to get more severe, the gums become swollen and they actually pull away from the teeth. And we'll talk about periodontal disease in a second, but the gum starts to swell and pull away from the teeth, which, if untreated, can actually cause teeth to fall out if the gums recede too much. One way we can kind of fight this is water has fluoride in it, and so does toothpaste. Fluoride is a way to harden the teeth. It's a way to harden the teeth, but it's not 100% going to prevent cavities if your main diet is sugar, right? If you're taking in a ton of sugar per day, then you can expect to potentially have cavities and issues with your teeth. Again, plaque is this biofilm. It's thick, mat-like structure, which means the enzymes that are in your saliva actually can't do too much damage to the biofilm. So you have to do a couple other things. You have to brush your teeth. You have to floss, and then even though you get rid of it, the bacterial growth will reestablish. So for every time you brush your teeth and floss and rinse your mouth out, it's going to overnight, it's going to replenish the bacteria that's present and create more plaques. If you are just curious, brush your teeth. Don't eat anything. Don't drink anything that has sugar. The only thing you could drink is water. And then take your thumbnail and scrape your front tooth. Any white film that you see from that is actually plaque, and that's basically a biofilm. The plaque can then calcify, and when it calcifies, it becomes what we call tartar. You may have heard that term before. And tartar is something you can't get rid of with brushing. You literally have to scrape it off the teeth, which is why going to a dental hygienist twice a year is a really good idea, because they can get rid of the tartar buildup. Periodontal disease. So periodontal disease basically is the inflammation of the gums. Now, there are varying degrees of severity. You can have gingivitis, which is really the infection is restricted to the gums, and it's not very severe. It's severe enough, but not as severe as some other types of periodontal diseases. So in this case, you can see that there's blood after brushing the teeth. Here's the tartar that needs to be scraped away. The other thing to take note is the recessed gums. So at one point where all this tartar is built up, the gum line was up here. But because of the periodontal disease, the gums start to recede, and you can see it pulling down the gums. Same thing here. The gums are receding, exposing more of the base of the tooth. This is a big problem because it causes the teeth to become loose and potentially fall out. Now, periodontal disease can be managed. About half the U.S. population suffers from gingivitis, which is kind of the most basic form of periodontal disease, and it's characterized by bleeding gums when you brush them. Lots of different bacteria can cause this. Now, if it's more severe, like this patient, you can see the gums are all pretty reddish purple. Same thing down here. They look swollen. This is periodontitis. Okay, the gums are inflamed really easy. There's pus pockets that will form in the gaps. So down here at the base and up here, you would have pus pockets that form below the gum line. And basically the support structures, the gums and the bone that hold teeth in place, start to weaken, and then eventually, if they weaken enough, that tooth falls out. So periodontitis is a much more severe form of gingivitis. Okay, gingivitis is the more basic form where you have inflamed gums and a little tenderness and maybe some bleeding when you brush your teeth, versus periodontitis where the inflammation is severe, the gums recede significantly, you can see clear swelling of the gums and pus pockets that move towards the root tips. Again, this just shows you, or this is just saying what I was mentioning before. Swollen gums pull away from the teeth. Those gaps can be colonized, causing abscesses, and then complications, you can lose the tooth and or bone damage. When it comes to diseases of the teeth, it is important to remember that dental cavities, they start out with strep mutans, and about halfway through it, a species of lactobacilli takes over. Now, there are several species, but whichever the predominant one is will take over. All right, so let's start moving downward in the GI system. Let's talk about foodborne illnesses, and specifically bacterial illnesses. Now, there are two terms that a lot of people misuse, or they may even not know the second term. When somebody gets sick after eating food, they typically use the term food poisoning. And to them, a non-scientist, that term is acceptable. But for us, food poisoning means something very specific, versus food infection, which means something completely different. Both cause GI infections, or GI disease, but in different ways. A foodborne infection is you have to consume the organism and it has to establish an infection for you to get sick. And this takes a couple days usually. Shigella, E. coli, Salmonella. But some of this incubation period is pretty wide in terms of about 1 to 5 days. In some cases, it's a little bit longer. So they have to colonize. They then have to establish their colony, and then they can cause illness. That is a foodborne infection. You're going to see fever, headache, muscle aches, nausea, diarrhea, lower back pain, abdominal pain. And recovery can be days to weeks depending upon which pathogen you have that's causing this. Food poisoning, on the other hand, is also referred to as food intoxication. Food intoxication is simply you ingesting a toxin that a pathogen is producing. Now, a good example. You go to a buffet, you get a salad, okay, and there was a person before you that sneezed and it got past the shield thing and bacteria landed on a piece of lettuce. That bacteria sits there for X number of hours, and part of its normal metabolism is producing this toxin. and it's producing and secreting this toxin over and over and over and over again until you show up and you grab that piece of lettuce and you eat it. Here's the catch. The bacteria does not need to colonize. You have now just consumed a bunch of bacterial toxins, so you will get sick very quickly. Okay, we're talking less than 6 hours. So you consume food and the toxin has already been produced and you're consuming large quantities of the toxin, which means you're going to be sick relatively quickly. Now, the symptoms, since there's no infection, you wouldn't expect a fever, right? Infections, you should see a fever. But more commonly, it's nausea, vomiting, and depending upon what organism, diarrhea. When it comes to food intoxication or food poisoning, it'll usually clear out on its own within 24 hours, maybe 48, but it clears out on its own because remember, they're not colonizing. You just ingested a ton of the bacterial toxin. So you just let it run its course. And that's going to be a common theme among GI infections, is just letting it run its course. And treatment being water, rest, and giving electrolytes to maintain electrolyte balance. Because most of these things will clear out within a couple days if it's food infection, maybe a little longer. And if it's food poisoning or food intoxication, you're talking less than 48 hours. So usually it's just supportive care. It's just fluids, hydration, electrolytes, maybe a medication for nausea, but usually it just goes away on its own. So the leading cause of food poisoning, food intoxication, is Staph aureus. It's associated with dairy-based food, poultry, meat, and Staph aureus can be part of the normal microbiota of the nose and skin and throat. And easy to transmit if you don't wash your hands before preparing food. Here's a likely scenario. My favorite meal, corned beef and cabbage. Gets cooked in a crock pot for 6-8 hours, something like that. If we were to turn off the crock pot after it's cooked and just let it sit there and leave it alone for, let's say, 4 or 5 hours, that's a problem. Because if we were getting food prior to that from the crock pot, we could have introduced Staph aureus from our nasal passages or from our skin onto the food that was left in the crock pot. We turn the heat off, we just let it sit there for a while, and then let's say I decide to come back and eat some of it. That's a problem, because if Staph aureus was present, at that point it probably colonized and created a bunch of toxins, and I could get very sick. So you should really, if you leave food out, you really shouldn't eat it unless it's been on a constant heat. If it hasn't been on a constant heat, yes, microwaving will help warm it up, but microwaving is not a sterilization technique. It'll get rid of some pathogens, but it won't get rid of all. Okay, microwaving is not a sterilization method. So, Staph aureus being so common in the nose, skin, and throat also is one of the leading causes of food poisoning. Now, there are a couple others, but this is the one we've talked about a lot, Staph aureus. Let's continue moving down to stomach ulcers, which are caused by Helicobacter pylori. Okay, Helicobacter pylori. This bacteria is pretty incredible because most bacteria can't survive our GI tract in terms of our stomach. The small intestine, large intestine, not so bad. Mouth, not so bad. But the stomach has all these acids and salts and enzymes to help break things down. So then it's like, well, how can this organism survive? But it's got an interesting method, a couple methods that I'll talk about in a minute. So who can be infected from this? Pretty much anybody. It's a true pathogen. However, people that live in developing countries that don't have the proper water treatment or sewage treatment facilities tend to have a higher risk. Symptoms, most are asymptomatic, but those who are symptomatic have gastric ulcers, stomach ulcers, which can also lead to nausea, vomiting, abdominal pain, severe abdominal pain, and sometimes bloody stool. Because if your stomach is bleeding, right, it's going to go through the small intestine, through the large intestine, and then out through feces. So you may see blood in the stool. That is a possibility. Not a definite, but it could happen. Cause of the symptoms, it has a flagella that allows it to burrow into the mucus lining of our stomach to escape the stomach acid. So I mentioned before that we have a lining to our stomach, and then we have a mucus membrane on top of that to help protect it from all the stomach acids. Well, this bacteria has a flagella that allows it to burrow into the mucosal lining to escape those acids. Then they secrete enzymes to decrease the acidity around them so they can survive. And then lastly, they will release a toxin, which will cause death in stomach cells, what we call epithelial cells that line the stomach. So, again, polar flagella, burrow in the mucosal lining, enzymes to decrease the acidity directly around them, and then they can release a toxin. Transmission, fecal-oral, that's going to be for most of these pathogens, fecal-oral. Improper water sanitation and food handling is also a potential way. So there's a thought that there might be direct transmission through improper food handling or water sanitation, but that's not the main way it transmits. The main way is fecal-oral contamination. Diagnosis. So for Helicobacter pylori, diagnosis, there's a couple things that we can do. First, we can look for antigens against Helicobacter pylori in the stool or antibodies in the blood. So we can look for antibodies against this bacteria in the stool or the blood. There's something called a urea breath. Basically, your breath actually smells like urea, so a strong ammonia smell to it. And that's because what's happening is the stomach, this organism is triggering production of ammonia. So you can actually smell it on the breath. And then if you do a biopsy of the stomach, you should see lesions. Treatment, fluids, antibiotics. Those are really the big ones. Usually, in addition to antibiotics, you give somebody what we call a proton pump inhibitor, which is essentially a medication to reduce the stomach acidity. You've probably taken a proton pump inhibitor before if you've ever had, if you've ever taken like Tums, for instance. There's stronger medications that can be prescribed, but basically it's reducing stomach acidity, so excuse me, so the ulcer can actually heal. Because you got to imagine, if you have an exposed ulcer and there's constant stomach acids hitting it, then it's really not going to heal very well at all, if at all. So we can give a proton pump inhibitor medication that will reduce the stomach acidity so the ulcer can actually heal. And if somebody has like GERD or constant acid reflux, people are given proton pump inhibitors to reduce those symptoms. So that's a common treatment. These things can grow in low pH acidic environments, so that's not really a shocking statement, because we know where it tends to colonize. This is a really great image from your book. It shows this progression of Helicobacter pylori. You can see that in here we have, it infects the mucosal lining, so it uses those flagella to infect the mucosal lining, so it's protected against the stomach acids. Colonizes, it starts to eat away at the erode away the lining and cause tissue damage, and then eventually the epithelial layer of the stomach, this epithelial layer down here, right here, these cells, those become exposed to the stomach acid, and the stomach acid starts to destroy them, leading to an ulcer. And this is what it looks like when you look via endoscopy, the little camera that goes down the throat. So you can see how the progression works with Helicobacter pylori. First, it invades the mucosal lining, colonizes. It then starts really kind of causing inflammation and erosion of the mucosal lining, exposing the epithelial cells, which then are exposed to the stomach acids, and then you end up with a stomach ulcer. Stomach ulcers are extremely painful. If you've never had one, you are very, very lucky, because they are extremely painful. I've had one in my life, and I would never wish it on anybody, because it essentially forced me to be doubled over in pain constantly. But luckily, this can be treated. Antibiotics, there's usually 2 or 3 that they use at the same time, but antibiotic treatment, fluid replacement, electrolyte replacement, etc. All right, Shigella or shigellosis. The disease is shigellosis. The organism is Shigella sonii. So Shigella sonii is the more mild version of shigellosis. There is a more severe version called Shigella dysenteriae. That's more severe. So sonii is the most common that causes shigellosis, but Shigella dysenteriae is the more severe version. But we're going to focus on sonii. Okay. Who can be affected? This is highly contagious, so toddlers are most likely to become infected. So children in daycare This is a common problem in daycare because fecal-oral transmission, children don't know how to wash their hands well, or they don't do it well. So fecal-oral transmission. Travelers, people traveling to other places in the globe, and they come into contaminated food or water. Incubation period's pretty short, so they get sick pretty quickly. Usually like 2 days, 48 hours or so. So, who's affected? Children in daycare, so toddler age, and then travelers to places that have poor waste treatment facilities and water treatment facilities. Symptoms. So, one of the things about Shigella sonii is that this organism is extremely pathogenic. It takes less than 100 cells to cause infection, specifically causing gastroenteritis, inflammation of the stomach and the intestines. And what you have is, because there's colonization, you would have a fever, right? Anytime you have something colonized, you're going to get a fever. Almost all the time, you're going to get a fever. You'll have some abdominal cramping, lower back pain, and then bloody diarrhea. So blood in the stool. These are all pretty common symptoms with GI diseases. Okay, these are all pretty common. But the cause of these diseases, for instance, the shigellosis, it's a food infection, so that's one. It produces a toxin called the Shiga toxin, SHIGA, Shiga toxin. It also invades host cells and can withstand acidic environments. So, food infection creates a Shiga toxin, invades host cells, and can withstand acidic environments. Now, the Shiga toxin actually kills cells, so it's a hemolysin, basically destroys cells, and sorry, which leads to blood in the stool. This organism is, again, highly, highly contagious. Washing hands, obviously, is one of the ways to prevent it. But transmission, fecal-oral route. Sometimes you can have direct contact transmission. So if you have it on your hands, right, you can touch somebody else's hand and there's direct transmission. Make sure you have fully sanitized, if you're traveling, fully sanitized water. Drink only boiled water and well-cooked foods. I've seen a couple documentaries on certain places across the globe that this type of disease, shigellosis, is extremely common, and part of the reason is because people buy bottled water, and what they do is they reuse the bottles. There was an actual news article, and they reuse the bottles, and they put tap water in it. So you think you're getting bottled water, but it's actually tap water. I have a link to that, I think, somewhere in this PowerPoint. If it's not in this PowerPoint, I will post it when I can find it. But it was a news article about that specific issue, which was very interesting. Diagnosis. So you can have you can take a stool sample, you can plate it on McConkey, several other types of media, blood auger, for instance. You can take a rectal swab, so you can take a swab of the rectum and try to look at it under a microscope. And then also serotyping. We've talked about this, right? So we can look at the antigen that sticks off the cell wall and see which version it is based on the antigen that's present. We talked about ELISA and agglutination, right? Looking at the antigens. Treatment. So that's diagnosis. Treatment. Electrolytes, water, antibiotics, and sometimes an antitoxin, which makes sense because, yes, it's colonizing, so there's an infection that needs antibiotics, but they also produce a Shiga toxin, so that means you would also need an antitoxin. You'd also need an antitoxin. All right, extra information. With this disease, with this pathogen, it typically likes to multiply in the small intestine, but then moves to the large intestine. And it can cause something called HUS, H-U-S, which stands for hemolytic uremic syndrome. Hemolytic uremic syndrome. Second. And there's 3 parts to this. And this is if it goes untreated and becomes a very big problem, it can lead to HUS. So, especially in young children. Hemolytic uremic syndrome. Hemolytic anemia means low red blood cells. Renal failure is another part of HUS, which is kidney failure. And then the last part of the third part is thrombocytopenia. Thrombocytopenia, which is low platelets. Okay, so low platelets, which prevents clotting. So you can see that if untreated, it can lead to a very serious syndrome that can be deadly. Okay, a child that has HUS has a very low chance of survival if it's not treated immediately. By the time this progresses to HUS, then it's really hard to treat. Here is an example, as I mentioned, in the cause of the symptoms, right? It makes a Shiga toxin. So up here is the toxin right here. Also, it invades the lining of our intestines. So these are the cells that line our intestines. It invades them. It can move from one cell to the next. And then lastly, it can actually kill macrophages. So macrophage can phagocytose this, and this organism will release some toxins, and it will trigger apoptosis of the macrophage. So it kills the macrophage. These are the causes of symptoms: endocytosis induction, toxins, the Shiga toxin, actin propulsion, meaning it moves from one cell to the next, and it can kill macrophages. This is more for, now both Shigella sonii can do this, but Shigella dysenteriae is a bit more severe and can use all these mechanisms to cause illness. All right, so got through shigellosis. Let's talk about salmonellosis, okay, or Salmonella enterica. So we're going to talk about Salmonella enterica, then we're also going to talk about another one called Salmonella typhimurium. So first off, salmonellosis, Salmonella enterica. Who can be affected? Young kids, typically through contaminated meat and eggs. Contaminated meat and eggs, and the fact that they have poor hand washing skills. I mean, it comes down to washing your damn hands, right? So, young kids who don't do this very well can have a problem. So, kids in daycare, just kids that are around each other on a regular basis. This is kind of common. Undercooked, as I said, contaminated meat and eggs or undercooked meat and eggs. The reservoir for this organism. So this organism is typically found in these in birds, rodents, and reptiles. So remember, a reservoir is something that houses the pathogen normally, right? So birds, rodents, and reptiles have salmonella as part of their normal microbiota. We do not. It makes us sick. But for them, it's part of their normal microbiota. This is why my son Benjamin, being almost 2, if he touches any of our bearded dragons, if we let him pet them or hold them, we have to make sure that we immediately wash his hands very carefully, because reptiles are reservoirs for salmonella. And young children with poor hand washing skills are highly susceptible to getting salmonellosis. Symptoms: gastroenteritis, so that tells you inflammation of stomach and small intestine. Diarrhea, fever, chills, headache, vomiting, all common symptoms in food infections. Because it's a food infection, right, it colonizes, and then it leads to the illness is caused by many types of symptoms. First off, it is a gram-negative organism, and it produces an endotoxin. It has the ability to survive high acidic environments. It will invade the intestinal mucosa, meaning the mucus lining of the intestines. It will also invade that. And when it invades the intestinal mucosa, it rapidly replicates. So for this, generation time is like 12 to 36 hours. Not generation time, incubation time, sorry. Incubation time. So incubation time is 36 hours or less, usually. So that means you're going to have this organism multiplying very quickly. Let's see. They can also escape phagocytosis. And if the macrophages engulf them, if they do actually get phagocytosed, they can multiply inside the macrophage and essentially kill the macrophage. So these organisms are really good at what they do, of causing disease. Transmission, well, fecal-oral transmission. We know this, okay? Making sure that meat and eggs are properly cooked, that's important. Don't use the same surfaces when you, let's say if you're cutting meat products and then you go to cut vegetables, don't use the same cutting board. Wash it or use a different one before you start cutting things. Raw meat contamination is a problem. Diagnosis. First, you can get a fecal sample and a rectal swab, and we can use the rectal swab for looking at it under a microscope. We can use the stool sample for isolating it on different media, so McConkey, blood auger, a couple others that we've never talked about, but you can use different media as well to help with that. The other thing is serotyping, so basically looking for surface antigens. Again, looking for antigens is an easy way for us to find out if a specific antigen is present. ELISA, agglutination tests, very, very easy to do. Treatment, water, rest, electrolytes, sometimes, but not often, sometimes antibiotics. Not often, but sometimes antibiotics. Also, you'll be treated for symptoms. So basically, if you have diarrhea, they'll end up giving you Imodium, something similar to Imodium, or if you're nauseous, they'll give you an anti-nausea medication. But for the most part, it's just kind of waited out and have to deal with it for a couple days until it passes through your system and your immune system takes care of it. So most cases, it's just kind of waited out compared to actively treating it. Right? Salmonella typhimurium. So Salmonella typhi. First off, this is a human disease. I want to make that very clear. Again, it's also fecal-oral transmission, just like all the other ones. But what I want to point out is this is a much, much more severe version of salmonellosis. Salmonella enterica is bad, and it causes salmonellosis, makes you pretty sick. But Salmonella typhimurium, or Salmonella typhi for short, is significantly worse. Salmonella typhimurium causes typhoid fever. This is a true pathogen. Anyone can get this, and it has a very high mortality rate in children. There's a very high mortality rate in children. Symptoms: gastroenteritis, diarrhea, nausea, vomiting, headache, and then also it's characterized by a fever. Now, this makes sense because it's an infection, but this fever is one of its unique characteristics. It's a fever that does not go away. It's sustained, and it usually stays between 103 and 104 degrees. So this organism is extremely dangerous, and one that if you suspect you have, you need medical treatment immediately. It's very rare nowadays, but still, it's very serious. So, symptoms: gastroenteritis, diarrhea, nausea, vomiting, headache, and a sustained high fever of between 103 and 104 degrees Fahrenheit. Very dangerous. Cause of the symptoms: it is a food infection. It also makes an endotoxin. Oops, sorry. Diagnosis: stool sample, and we try to isolate it using different types of media, rectal swab, and we can undergo serotyping, again looking at surface antigens. Treatment. So treatment is extended therapy with specialized antibiotics. So you use very specific narrow spectrum antibiotics for a very long time. once patient's been under that extended therapy for sometimes 6 months, could be even longer depending on the severity, then after that, there is a small risk that some of them will be carriers. This will colonize in the gallbladder. So you may get better after that extended therapy with specialized antibiotics. But some people, a very small percentage, we're talking like 1% of anybody that's ever got, of all the people that get this, can become asymptomatic healthy carriers. There's a really famous case of a lady named, they dubbed her Typhoid Mary, who was one of those carriers. Now, again, this is a human disease, and we don't see it too much in the U.S. because we have pretty good sanitation and water treatment facilities. But when we do see it, it's very, very severe. I'm going to, at some point, post just a little video about Typhoid Mary just so you can see how severe it is. It's very interesting. You don't have to watch it, but it's one of the more famous cases of Salmonella typhimurium, Salmonella typhi. Cholera, Vibrio cholera. So Vibrio cholera is a really interesting organism. We kind of talked about it a little bit when we talked about toxins. We said there was a cholera toxin, but we didn't go into it very much. So the organism itself is Vibrio cholera, and it's a gram-negative bacteria. Who can be affected by this? Well, in developed countries like the U.S., it's pretty rare, where as if you were to go to Southeast Asia or certain places in Africa that are lacking, proper sanitation and water treatment facilities, you're at risk. So technically anybody could be at risk for this, but people that live in underdeveloped countries where they have poor sanitation and poor water treatment facilities are at a higher risk. Incubation period is just extremely short, which is a big problem. So symptoms: vomiting and profuse and watery diarrhea. So excess, lots and lots of bowel movements and extremely watery diarrhea. So those are some of the basic symptoms that you'll see. And I know they're pretty generalized, right? Pretty much every other organism we've talked about has the same thing. So what's important is that you be able to diagnose it by other means. So the causes of the symptoms, so the pathogenesis, is that there's a cholera toxin, which what the toxin does is it triggers the epithelial cells in the intestine to release water and ions into the intestine, which triggers watery diarrhea. Okay, so let me repeat that. The cholera toxin triggers the intestinal epithelial cells to release water and ions into the intestines, which generates the extremely watery diarrhea. Okay, the extremely watery diarrhea. Now, what's going to happen is because of this watery diarrhea, the patient is going to have some other problems, some complications, and we'll get to those in a minute. But the cholera toxin triggers that water and ion release. Transmission, fecal oral route through contaminated food and water, as well as human to human. There is a vaccine for people typically between 18 and 64 that like to travel. It's a live vaccine, which makes sense why you don't want to give it to somebody that's young, because a live vaccine is not a good idea for young children or the elderly. So if you were to travel to places where cholera is common, you would want to get that vaccine. Now, it doesn't offer total protection and long-term protection, but it does help decrease the risk of getting and contracting this pathogen. How do we diagnose this? Stool samples, we diagnose it through bacterial cultures. So we take a stool sample, we then culture it on media. We also will try to stain it, and we can also use serotyping, which we're looking for antigens, right? We're looking for antigens. And how do we treat it? We treat it with, if it's mild, we treat it with rehydration, IV fluids, for instance, that have also providing some electrolytes and ions. And then antibiotics. And depending upon your age group, if you're pregnant or not, the antibiotic will actually vary. And some people it's doxycycline, and another group, I think pregnant women, is azithromycin. But those, you can see how they're just depending upon what group you fall into. There's different antibiotics that are given to different people. Sorry. So some of the complications associated with this, if there's no treatment, is that, so with these complications, you start to see low blood volume because you have such severe diarrhea. Something called hypovolemic shock. Hypovolemic shock. HYPOVOLEMIC. Hypovolemic shock. What that is essentially, it's a very severe life-threatening condition where you lose more than about 20% of your body fluids. Okay, and because you lose so much, that's about a fifth of all your body fluids. You start to have problems in terms of your heart, your lungs, and you have almost total organ failure if you don't get treated for this. So hypovolemic shock is really severe complication. And if it's not treated, because of the decreased blood volume and the decrease in fluids in your body, it can lead to organ failure and eventually death. But luckily for us in the US, we don't see this very often. But when we do, we know which antibiotics we can use to treat. Giardia. So Giardia is pretty interesting because it's a protozoa. It's not bacterial. Okay, it's not a bacterial infection. It's a protozoal infection. Giardia is what we call a flagellated protozoa, meaning it has a flagella and it's a protozoan. It's caused by Giardia lamblia, and when it comes to who can be infected with this, it's really anybody that consumes contaminated water. It's an intestinal protozoan, so if you drink untreated water, or you drink stagnant water, for instance, you can consume this protozoa in the process, and it tends to live a long time outside of humans or animal hosts. So one of the reasons you're not supposed to drink stagnant water that's not moving, is because these things can aggregate, and then you consume something that's stagnant, which has lots of pathogens in it. It's worldwide. It's not something that's unique to one country or another. You can find it pretty much anywhere you find stagnant water. So untreated water is the biggest problem. This is the most common intestinal protozoal infection in the U.S. So giardiasis, Giardia is pretty common here in the U.S. Symptoms, diarrhea for extended periods of time. So what we call prolonged diarrhea could be up to 6-8 weeks. Just not feeling well, nausea, just general malaise, being very gassy, muscle weakness, weight loss, cramps, vomiting, malnutrition, right? Malnutrition is a big one. So these are all symptoms associated with giardiasis. The causes, well, basically, what they do is they attach to the lining of your intestine, and actually you can see in this image the ventral sucker right here. So this portion right here this is the Giardia protozoa. It actually forms a suction against the wall of your intestine, and when it does that, it just they line your intestine, and as nutrients come along, they absorb them and you don't. So it blocks absorption of nutrients in your body. So that's one of the causes of these symptoms, is with the malnutrition and the other issues like cramps, for instance, and diarrhea, is the fact that it actually attaches to the wall of the intestines and then blocks the ability for you to absorb nutrients. A couple other problems. It's resistant to chlorine, so you actually have to boil the water. So cause of the symptoms, you could say it's resistant to chlorine. So you need to treat, so treating the water is the first step. If you only treat the water with chlorine, for instance, it's ineffective. What you have to do is you have to treat it and then boil it. Or you could just boil it. You don't have to treat it with chlorine. But boiling it is essential, because the cysts, these organisms are resistant to chlorine. Transmission, fecal-oral route. You can also because it can survive outside a host for a while, fomites. And one of the problems is, because this is really so pathogenic, you need fewer than 15 cells or so, 10 to 15 cells, to actually establish an infection. Okay, so 15 to 20 cells to establish an infection. That's not a lot of cells. So consuming, stagnant water where you bring in hundreds, if not thousands of them, that's more than enough to cause an infection. Diagnosis. So we diagnose a couple ways. There's a few things that we can do. First off, an endoscopy. you can go and look for these. You can take a piece of tissue and do a biopsy, or you can look at the feces. You can look at a fecal sample and look for cysts or some form of their life cycle. There are molecular methods as well to detect antigens that it creates. And then there's one that's really interesting. I've heard it. I've seen it done. I've never actually had it done. So it's called the string test. And what they do is they don't do it very much. They don't really do it too often nowadays, but they used to. They would have a capsule and they would have a string that was in it, and they would tape it inside your cheek between two teeth. They'd tape it to your cheek. You'd swallow the pill. It dissolves. The string goes all the way down your stomach to your small intestine, and these protozoa don't know the difference between your intestine and the string. And what they'll do is they'll leave it there for 24 to 48 hours, go back to the doctor, they pull it out, and then they take a sample from the string, and then they look for them under a microscope. Very interesting. It's just called the string test. I've seen it done, but I've never actually had it done myself. I have had Giardia before. Before my son was born, my wife and I liked to run Tough Mudder competitions. We would do 3 or 4 a year, and one year I jumped into a muddy pond and accidentally swallowed a whole bunch of water. This was on a horse farm, so it was obviously contaminated with some type of feces. And I ended up with Giardia for about 10 weeks. And having Giardia for 10 weeks, having this persistent abdominal cramps, gas, nausea, diarrhea for that long is horrible. Giardia is an extremely, extremely dangerous pathogen. Luckily, we can treat it. Basically, we can treat it with anti-protozoal medications and supportive therapy. So basically, helping patient get water, right? IV fluids, electrolytes, making sure that they're replenishing those because of all the severe diarrhea and the fact that it could lead to hypovolumic shock, right? You're losing a large quantity of your blood volume and your fluid volume. So having supportive therapy is pretty important. One thing that worked really well is Pedialyte. Tastes horrible, but Pedialyte, I pretty much lived off Pedialyte ice pops for about 8 to 10 weeks. And even though they can also treat with an anti-protozoal medication, you have to treat for an extended period of time. And even though I was taking anti-protozoals, still needed to replace some of that fluid that I was losing. So Pedialyte was a really good substitute, even though it tastes horrible. So if you're ever not feeling well after you eat something, not sure if it's food poisoning or if you're just dying, it's probably food poisoning. Because remember, food poisoning happens very quickly, right? It has to do with intoxication, right? You're consuming a toxin and you get sick very quickly. Versus food infection, where it takes a couple days before you get sick. Make sure you focus on the difference there. All right? That's the end of this chapter. This is the last chapter that's on the exam, so I suggest you watch this video a couple times, get the key information for some of these diseases. One thing I would suggest is don't focus on every piece of information for every disease. Find the information that's unique, right? Maybe it only affects a certain population, or maybe there's a specific test to diagnose that's unique, or a unique symptom. Look for the unique as opposed to focusing on every single piece of information. Because if you focus on every piece of information, then you're going to get very confused very quickly. For the homework, there won't be any case studies, but for the participation assignment, I will put up at least 1 or 2 case studies. Even though exam number 3 won't have more than 1 case study, maybe 2 at most. The final has almost all the case studies. We still need to practice, so you will still see some examples coming up. Again, focus on the unique, not every single bit of information for every single organism. All right? Have a good day, and if you have any questions, please feel free to reach out, email me, or stop by my office hours on Tuesday. All right, have a good one. Stay safe.